You misunderstood his saying.
They take the names of the husband, they take the name of the wife, they take the name of all the children. So if three women in that household give birth, there are three different names giving birth. So the second we have a medical cover. So that idea that it's a system failure, if a failure is in the fact that they are not recognizing.
All the personalities. You obviously misunderstood what he said. Take your seat. You misunderstood his saying. Teenage mothers. Hold on the personalities. You know, you can't be educated over misunderstanding. He explained very well on the issue that if your 9-year-old girl gets pregnant, and I've seen 10-year-olds, 11-year-olds, or prenatal clinic clients, I visit and I see them. A 9-year-old, a 10-year-old, a 12-year-old has no idea. So he said, extra personality of the he said, when they are registered, they use their mother's ID. The ID of the mother is in the system. Maybe you have another child who has run into another running character, made her pregnant, yes, ID is used again. If you are a mother who is still of childbearing age, your ID is used to register that child. So you end up having 3 children on one ID, born the same year. Biologically not possible, but practically because of the ID being used, it looks so. Is it right what you say? Yes. So where is that personality? Go on, please.
Thank you, Honorable Chair. Thank you, Honorable Chair.
Order. Extra personality. You are not a very order, my dear. What's the problem? Stop being agitated. Go on.
Thank you. I think the CEO of SHA has ably responded to most of the questions raised by the honorable members. I'll just fill the gaps. One on the Honorable Tongei. We agree that most of the public who want to seek service at the facilities are not aware of their benefits. We've taken note of that, and we are working on a directive to all the facilities so that they print all their services they offer under SHA and the benefits that the patient is entitled, so that it's a public information. They don't need to go to the legal notice. They simply see what is being offered. On the system, the digitization system that did not work at KNH, yes, action has been taken, and now we've got additional storage, and we've also cautioned Safaricom not to take us to that route again. In fact, there is now an investment on a bigger storage capacity that by February, we will not have the challenge of the system in terms of the storage capacity. The question that Honorable Shumwa asked, who is the complainant in regard to the lady who was arrested? Yes. The complainant is the Minister of Health. I am answering the question. The accounting officer, in the Ministry of Health, we have 2 accounting officers. One who is here today and another one who is not here today. We are 100 members. I want to explain here what steps we took. Let me just explain. One, because what happened was our cabinet secretary was issuing a press statement.
Cabinet is a woman.
Yes. And then, all of a sudden, we saw some group, we didn't know who they were initially. Wait a minute. Agree. Okay, women. So, what?
just hold your horses. If I were you, I'm not to give you clear. Those women who stormed into the minister's prison, they came there to express frustrations that they are having out there. Hold your horses. From what I have picked from the video, there was no fracas, nobody was injured. And the minute to be in a public place, you cannot talk of Christmas. If I were you, in the interest of the image of your ministry and the public, I will be glad to pray.
Honorable Speaker.
What you do with it is up to you.
Honorable Speaker and honorable members, we've had you, and since the minister is a complainer, we are going to review the case, and if there is need for us to we are going to withdraw the case.
That matter rests there.
Thank you. I want to go to the one that was asked by Honorable Millie, that we need to create a special, I don't want to call it a special section, but we shall create a department that will be able to handle the complaints that emanate from the public in regard to the rollout of SHA. So that's another step that we are going to take. On the issue of transition, I can confirm that indeed we are transitioning very well, and within 1 year, if we will give our report, honorable members, you will see that we are at a better position than going back to the former NHIF. If need be, we shall only amend on those areas that have not been adequately addressed. On Honorable Kishimo, on the issue of the minister's instrument capacity, we realize we do not have the code for EDA for now, but I think we former NHIF staff, honorable members, all NHIF staff currently have been onboarded back to the public service and deployed to Social Health Authority for a period of 6 months to support SHA in implementation of the rollout, to give SHA an opportunity to onboard the number of staff that they will require. The rest of the staff that will not be onboarded into SHA will revert back to their public service, and they will be posted to any of the government agencies. So no member of staff of SHA will lose their jobs because they are already public servants. Honorable John Paul, on the issue of the shift not working, I want to confirm here that where the facilities have been empaneled, those facilities are providing services under SHA. Those that have not been empaneled or accepted to be empaneled are the ones that are not offering services under SHA. The issue of payment for medicine, I think once you go for treatment, the doctor looks at, examines you, gives you a prescription, and therefore that is what is prescribed as your benefits. It includes medicine. On the issue of the patient who came to petition the Minister of Health, honorable members will take note, and what MATIANG'I said is true. We had that system downtime at that particular time, and specifically where we had a big challenge was KNH, Kenyatta National Hospital, and that issue was addressed. The only, I think, what the police or the DCI have come to do is the chaos that the patient came to cause at the ministry. Otherwise, the ministry acknowledges, and SHA also acknowledges. Honorable members, I have said we apologize. We apologize first for there was downtime. I want to leave that.
PS Mutai, please note that this is a very common issue and there needs to be a whole government approach on it.
Speaker, thank you, Honorable Speaker.
Thank you. Thank you, Madam Speaker. Thank you, the PS, for your answer. Madam PS, you can see this is an issue that touches every member. The woman who was harassed is 61 years old. That's an elderly woman. Somebody's grandmother, not just a mother. Yes. And on top of that, this is a person who was seeking services. Yes. Was frustrated. You have acknowledged there was a problem. Why is that woman being arrested? I am asking the police, please arrest the people who disrupted the system. They are the ones who are causing the disturbance by disrupting the system. Not a woman who is sick, who is seeking assistance. It's very annoying. Honestly, it's very annoying. When we see a woman 61 years of age, 61 years of age, 61 years of age.
Yes, you are very annoying.
Thank you, Speaker. Thank you. I think the Speaker has directed that this. Thank you. On Honorable Salasha's question, Honorable Speaker, whether
you made your point.
Honorable Speaker, on the question from Honorable Salasha, whether public participation was conducted, I want to confirm to the members that public participation was conducted when we were coming up with the Social Health Authority Act and the other acts, and I think, honorable members, the House also participated, the Committee of Health also participated in public participation.
And let's now listen to the other issue.
And best,
we will address it, don't worry. Order.
The honorable member Salasha also asked whether we learned from the previous launch, the experiences of the previous launch of the UHC. I want to confirm that indeed we learned from the experiences of the piloted 4 counties. And what we noted then was that there was lack of legal framework to support universal health care coverage, and that's why we passed the 4 laws that are meant to support the rollout of the UHC. On the issue of the cancer patients, we take note and have said that we have considered a committee, a team, what's called the Committee of the Benefit and Tariff Package membership, that will review the benefit package for cancer patients, because we realize that the cost of treating cancer has gone up and we shall adjust according to the market rates. Honorable Mutunga, Dr. Mutunga, on why the confusion during the transition. This is always bound to be confusion because we took members of those members who are managing facilities, we took them through in terms of what are they supposed to do with the system. They needed to understand how the system works. How do a person comes? You remember we said we use your ID card. So there are those who are facing challenges. Some of those, when they go to the facility, you realize that they are not paid for their premiums. So at that particular time, some of the members of the public or patients were being told, you either pay cash or have your premiums activated. And I think that is where we had some challenges. I've talked about the oncology benefits, and I think I've said we are having a committee that's going to review these benefits of the oncology, which is specifically cancer. Honorable Madenge, I think the issue of grace has been addressed. The NHIF system, I've also talked about the indigents. We have the 950 million, which we are now working with the State Department for Social Protection to ensure that we capture those ones and we pay for them. The the issue of no visibility of SHA system in the branches. I think the system is used by the facilities. All the facilities who have been on panel can access the system, can use it, and they can see the claims that they have lodged. So I think there's visibility. And on the issue of the SHA staff, I think they have also the rights to access the system. Those who are supposed to access the system are given rights. Honorable Emase, on how long does it take to activate the data of an individual? I say that immediately you register and you're a paid up member, you're an active member there and there. So it doesn't take long for you to be activated. Patients who are registered and not paid up, yes, any patient who is registered and not paid up, when you go to level 4, level 5, level 6, where we expect you to use your social life insurance fund contribution or premiums, you will get services there. But if you have not paid, definitely, eligibility will be that you have not paid up member and therefore it will reject you. But for those who have registered, they can access their services at level 2 and level 3 without paying any premiums. So the other issue is very little is being paid. Sometimes it depends on the benefit package. If the benefit package means that you clear everything, then you will be entitled for that amount. So it does not go by an individual. It goes by the benefit package that you are supposed to access. Honorable Mheshimiwa Barto, on the classification, I want to report here that yes, there are 3 funds. The public health care fund, which is for level 2 and level 3, that is exchequer contribution. Social health insurance fund, which is referred as SHIF, is your personal premiums that you pay as a registered member, and the ECCRF funds are the funds that come through the exchequer, and it is for the members who are registered. So these are 3 different categories of funds, and you will receive the services accordingly. Honorable Kirima, on the SHA registration, and especially now, once you are registered as a SHA member, it doesn't matter where you are going to get your service. Once you are registered, you go to any county, you go to any facility, you will be entitled to services. You are not blocked like before, where NHIF used to say you must be a member registered for a particular facility. Under SHA, a member can go anywhere and he will be treated across the country. And I think the issue of contribution, we are all contributing to the pool of the social health insurance fund, whether you are paying 360,000 or you are paying 12,000 or whatever amount of money, that goes to the kitty, goes to that contribution where all of us benefit from it as an insurance. The Mheshimiwa Honorable Opara on the no service in Kasipul Kapondo, it is something that we require to investigate, but I so believe that any facility that is registered and any panel must provide service. We have not had cases where there are complaints from Kasipul Kapondo, but as I've told my team, SHA here will follow up whether there are facilities that are not getting services in Kasipul Kapondo. Yeah, the issue of the premiums, I think we have all agreed that you pay according to your salary, your income, it is 2.75%. That is the contribution. So, Honorable Bashir, on the issue of the pastoralist, I think we have the community health promoters within those communities. They are supposed to support in registration, and when they move, because they come from that community, wherever they go, they will always move with their community health promoters. So they will continue registering. So I think the issue here is campaigns that we must take to our people so that they register wherever they go, because we have mobile registration, because you simply use your phone to register. So it's not a complicated issue, it does not require you to go anywhere. It is indeed a mobile registration. Honorable Speaker, thank you. I so believe I've responded to the questions.
Honorable members,
the PS is an accounting officer in government. How is it that we can be confident that this information
I'll tell you.
I only need some question. Mr. Speaker, I need to ask my question.
Millie, you will be number 6. I now come to this slide. Who is the member raising both hands on the back?